So I just thought we'd run through a KFP example. So Maya is obstetrics, so I picked a really easy example for me. So Jane is a 32-year-old female. She's a new patient to the practice, and she thinks she's about 8 weeks pregnant by her last menstrual period. This is her second pregnancy with one previous vaginal birth at term. She has no past medical history and takes no medication. She is allergic only to penicillin with a reaction of hives. She's come to see you about an episode of PV bleeding that occurred overnight. She has no pain. So the first question may be something like, what are the differential diagnoses for her presentation? And usually it doesn't necessarily say list 4, but you get 4 boxes to fill in. The second question may be, what key investigations would you order? Choose 4. And now in the KFP, they have a list when they're asking for investigations. Unless they're asking for 1 or 2, they may get you to write them out. But if they're asking to pick from a list, the most important thing to note about this is there is obviously many options on there. And there are some that may score more marks than others. So some might score 2 marks, but there may be 6 or more correct answers in a list. They ask you to choose only 4. So don't get too worked up in your head about which one is the most right. Just pick what you think you would order in this scenario in your office. And they will give you the list and you just select them. And then the third part of that question may be, what advice would you give about dietary restrictions in pregnancy? So, seems like a pretty easy question on the surface. And I did note, I read the last few exam reports and one of them did have a bleeding in early pregnancy question. So it is something that could come up. They don't tend to repeat questions over and over though. So I think as they talk a lot about, if anyone's done exam courses or on the ESO modules, about picking out the key features from the STEM in order to answer the question. And that's the first part of your clinical reasoning approach. Obviously in the KFP, you don't have the ability to ask your own questions and you don't have the ability to do your own examination. So you've only got the information they've given you, but that means every piece of information they've given you is likely relevant. So if you try and highlight some of the key features there, I think in this one it's that she's 32. Female is obviously relevant, but she's pregnant, so she can't be male. She's 8 weeks pregnant. And possibly by her LMP is relevant too. This is her second pregnancy. She's had a vaginal birth at term, which may imply that there's sort of relatively low risk. She's also got no past medical history, which is good, and she's on no medications. She's allergic to penicillin with hives. In this case, it doesn't seem to be that relevant, but we highlight it anyway. And she's had PV bleeding with no pain. And that's all you're given. And in my experience sitting in the KFP, some of the STEMs are very brief. So there's 100 different things that we want to know about this woman, but we just have to use what we're given. And that does help us answer the question in a way, because for her there is a broad list of differentials. So she could have a threatened miscarriage, she could have an ectopic, she could have had intercourse and got some vaginal trauma, she could have a cervical lesion, STIs, and she could have bleeding that's not pelvic, so urinary or bowel. It's a little bit late at 8 weeks, but it could be an implantation bleed. She could be developing a subchorionic hematoma, and then your rare stuff like molar pregnancy. So they've only asked for 4, so I think you could easily get 4 answers out of that. And some people may argue that, an ectopic is a less likely diagnosis because she's got no pain. But I think it's such an important diagnosis not to miss that anyone with bleeding in early pregnancy, you have to consider it. So I think that would still make it onto your top list. I think the other thing to note about the KFP is trying not to group your answers. So show that you know that there's a broad range of differentials, rather than writing, threatened miscarriage, ectopic, and then cervical polyp or cervical cancer. That's not really demonstrating that you know that there's other causes, because you've listed 2 cervical causes of vaginal bleeding. And although they're both right, they would argue that that's a grouped answer, so they're too similar to each other. In the same way, they don't want you to give lists. So they don't want you to say threatened miscarriage for example, incomplete miscarriage or complete miscarriage or blighted ovum. The term threatened miscarriage is enough. And the same way, if you do write cervical lesion, they don't want you to write e.g. polyp or cancer, because technically that's two different answers. So that's where the KFP becomes quite tricky, and we might have a bit of time to talk through that a little bit more tonight, but that definitely will be covered in more detail in the second webinar. But grouping and overcoding is one of the biggest fears, I think, about the KFP, and I think it is something to be aware of, but I don't think it's something to get too hung up about, because or else you spend most of the time trying to answer these questions in a way that RACGP want you to answer them, rather than just going with your gut and answering them with the answers that you know. So in this patient, say if you got a little bit more information, so you know that she'd had fresh, bright red PV bleeding for 4 days with some lower abdominal cramping, that would probably rule out some of those causes. You know, it's probably less likely to be vaginal trauma if it's happening day after day. And again, less likely to be an implantation bleed. But in this scenario that you're given, they haven't specified any of that information, so you can keep your list quite broad. And I think that's really where highlighting those key features, or you know, practicing writing them down if you have time in that sort of 7 minutes. If it takes you too long, I wouldn't worry, but if you have time, highlighting those key features so that you, one, are not missing anything and you're making sure you're rereading the question, I guess, twice to get them all. And two, that you're sort of identifying that either there is some things that make some differentials less likely, or that it's quite a broad question and you can be quite broad yourself. So moving on from that is, you know, your list of differential that you choose for Jane is going to be based on ruling in or out some of those diagnoses and also being safe. So if we flick back to the list we were given, you could argue that all of those are relevant because this is her first pregnancy, her first visit in this pregnancy, but some are more relevant than others. So at this stage, when she's having some PV bleeding in early pregnancy, I'm not really worried her rubella immunity status is, nor am I really worried about her vitamin D or thyroid level. I think what we really need to know is her blood group for sure, so we know whether she's anti-D or not. We need to know what her hemoglobin is. Is she concealing a larger bleed, or you know, is she an ectopic that has been bleeding slowly into her abdomen? And then you could make an argument for many of these. So I guess if I was choosing, I'd probably choose blood group and antibody screen, full blood count, maybe chlamydia urine PCR, and either gonorrhea urine PCR, or maybe even iron studies. And I think this is a KFP question that would have quite a few answers, so I don't think there would only be 4 on that list that are right. But I think if you did choose something like rubella or TSH or vitamin D, they probably wouldn't be technically correct, because you're trying to rule in or out your diagnoses or be safe. And there's not a lot on that list that you can really rule in or out. And I've purposefully left off the pelvic ultrasound because that's what we all want. But, you know, you're going to order some bloods too, so they don't necessarily give you a whole range, but they might as well. And then the last question in there is the question about diet. So what advice would you give about dietary restrictions in pregnancy? And that question is, yeah, it's a knowledge test, but it's also testing, you know, a common area of GP. So pregnancy is a very common presentation. And there's a lot of potential benefit you can give by giving people in early pregnancy some good advice, obviously about diet, but also about exercise, about medications, about smoking, about alcohol. So I think that's why, from what I saw in the exam report, it did say something about diet, but I don't know if it was, you know, what supplements should be taking, or what things should she avoid, or you know, what's some general health advice. So I've just obviously made that up. And they specifically asked there about dietary restrictions, and this is another common area where people get let down in the KFP. They don't answer the question. So that's not asking about what supplement should be on, so folate or vitamin D or iron. We don't even know what those levels are. And it's not asking about should she quit smoking or should she stop drinking. We also don't have any of that information. So writing smoking cessation would definitely be wrong because, one, you don't know she's a smoker, and two, it's not a dietary restriction. I feel that this question is asking more about, risk of food poisoning, risk of listeria, and so, she shouldn't eat raw eggs, she shouldn't eat raw fish, she should be cautious with food that's been sitting out and food from the deli and those kind of common dietary things that you say to people when they are in early pregnancy. And it's a hard one because this is where I have a problem with RECGP, but in my head those answers are all very similar. If you say don't eat raw eggs, don't eat raw fish, don't eat deli meats, and make sure you reheat your food really well, they're all sort of quite similar to me. But I think in this question, the question is so specific, your answers have to be very specific, which is another point on the KFP is your answers do need to be very specific. To this patient, your answer should be what you would tell her in your room. So what exactly would you say to Jane? Would you say, avoid, I don't really know how to word it. Yeah, like I don't think you would just say to her, avoid raw foods. You would say, avoid eating runny egg yolks, avoid eating raw fish, including sushi or something. That's an obvious example. And sorry, I'm not thinking of a good one off the top of my head here, but I hope that makes sense, that you should use very specific language as you would to your patient in the room.